When you think of a clinical psychologist, the picture that comes to mind is probably of someone in their office listening to a client lying on the couch talking about their childhood. But clinical psychology is more complicated than that. Clinical psychology is difficult to categorize because it's so broad in what you can do with it. And depending on the fellowship you choose after your doctoral degree, your career paths can be even broader. To start off, clinical psychology involves everything from research, teaching, and providing clinical services with the goal of understanding, predicting, and providing relief for intellectual, emotional, biological, psychological, social, and behavioral concerns. And if you love the idea of getting to hear a client's story and helping them work through their struggles, being a clinical psychologist who provides health services may be the right field for you. You also have to love learning. Psychology is a really complex field with many moving parts, and a lot of research is being done to help better understand and address mental health. While all psychologists must be constant learners to be at the top of their profession, clinical psychologists who provide services to clients have to keep up with the literature because their clients are really depending on them. Clinical psychologists work with a wide range of client populations. For example, during graduate school, I was providing clinical services for clients in the community at an outpatient psychology clinic, as well as at a local county jail. And during internship, I was working with U.S. veterans through a primary care clinic, as well as clients from the community in a GI clinic. Now during my fellowship, I'm working with adults who have serious chronic pain. Now some major skill areas that are important to clinical psychology include assessment, intervention, consultation, program development and evaluation, supervision, administration, and conducting research. But for the sake of this video, we're just going to focus on clinical psychologists that mainly provide health services for direct patient care. And we'll save what clinical psychologists do outside of patient care for another video. Now here are some ways to categorize clinical psychology. Outpatient versus inpatient. For clinical psychologists providing health services, working in outpatient settings is the most common. Clinical psychologists providing health services in outpatient settings work in a clinic or some sort of outpatient setting where clients schedule an appointment, have an initial intake from 30 minutes to 2 hours, and then head back home. Then if psychotherapy is necessary, these clients will come back on a somewhat regular basis for 30 to 50 minutes per session. Now in outpatient settings, you'll be dealing with interviewing, providing cognitive and mood testing, and addressing mental health symptoms by performing psychotherapy. With inpatient settings, you'll be caring for clients admitted to a hospital, meaning they're staying in a hospital for several days. Now these clients are usually experiencing bigger, more time-urgent crises than clients you'll be seeing in the outpatient setting. These clients can include anything from acute conditions or some sort of exacerbation of a chronic condition. For example, if somebody is diagnosed with bipolar disorder and they're experiencing a severe manic episode that could cause harm to themselves, they might admit themselves to a hospital and spend several days recovering there until they feel well enough to be discharged. In this example, a clinical psychologist in this setting would work with the patient to offer psychological care, and they'd help facilitate care throughout the stay, consulting with psychiatrists and other medical staff as necessary. Academic versus community versus private practice. Now for work settings, clinical psychologists providing health services who practice in an academic setting work not only in patient care, but also teach future healthcare professionals, including future psychologists and future physicians. Academic institutions are also better equipped to handle more complex clients, so these psychologists are more likely to work with clients with more severe health concerns. In community practice settings, you can work within a smaller or larger organization. Now at these institutions, your primary job is to be a provider. Research and teaching are not your principal responsibilities. Now a third option is to pursue private practice, where you'll be your own boss, working primarily in an outpatient clinic setting. Now in this setting, you might be the only psychologist on staff, or you might work in an office with a few other colleagues. How to become a clinical psychologist providing health services. To become a health service psychologist with a doctorate degree, first you'll need to go to graduate school, which can vary in length from 4 to 7 years here in the US. Your last year of graduate school typically involves a 1-year internship in a setting outside your graduate institute where you'll get more clinical training. Now these settings can include medical centers, community hospitals, VA medical centers, federal prison systems, university counseling centers, the list goes on. You'll then apply for internship sites you're interested in attending, and then you match after you and the sites rank one another. During your internship, you'll be focused on clinical work, regardless of the setting of your internship. And while on internship, you'll rotate through different clinical experiences where you can get a wide breadth of training for that 1 year. Now, the experiences you'll get on internship depend on the internship sites you apply to, and that ultimately depends on where you applied and what you want your career to ultimately look like. For example, in outpatient rotations, you'll be seeing clients while establishing continuity of care with them, providing you with a more longitudinal relationship with your clients. Thank you all so much for watching. Did you have any questions? If so, please make sure to leave your questions down below and leave any other comments for psychology topics you'd like me to cover in future videos. Thank you.